Hello, I am Dr. Manish Baviskar. I'm a practicing orthopedic surgeon mainly in Thane, Maharashtra. I specialize in trauma and joint replacement, and I've been practicing over the past 12, 15, 12, 13 years in the city of Thane. Today, I'm going to speak about the importance of musculoskeletal health overall well-being of our daily lifestyle, as well as the importance of that in the morbidity and with the ultimate outcome of quality of life in the whole. So the importance of musculoskeletal health in overall lifestyle. So if you ask me what is the importance of musculoskeletal health in a daily lifestyle, it plays a very, very, very important role to keep up good mobility and dexterity in a daily lifestyle. Importance of enhancing the ability to work and actively participate in all the aspects of life. Good musculoskeletal health is very important to maintain the economical, social, and functional independence across their life course. Physical activity has a crucial role in reducing the risk of other non-communicable diseases, which I call pet diseases. These are diseases like blood pressure, diabetes. These I call lifestyle diseases because these are not something which are contagious. These bring them upon ourselves. We know that these diseases are harmful for us. These diseases are harmful for us, and they are going to harm each and every aspect of our daily lifestyle in the future. Because of our daily lifestyle, we ignore the red flags and take these diseases upon us. You should have seen that in the past couple of years of pandemic of COVID-19, these non-communicable diseases have been the ones which have brought about. They have a major say in the ultimate outcome of the disease and the progression of the disease in a patient. Patients with comorbidities obviously have had the morbidity and the mortality in these patients has been much, much higher in this pandemic. That's the reason why these non-communicable diseases have to be kept in day. The first step towards that is good musculoskeletal health. The relationship between painful musculoskeletal conditions and reduced capacity to engage in a physical activity is the most important relation. Can this impaired musculoskeletal health can lead to acute as well as chronic pain, causing limitation in your physical activities, proceeding to a loss of social as well as professional participation and withdrawal from these activities, further decreasing the quality of life and well-being. As we say that as the age advances, we should not look at the quantity of life; we should look towards bettering the quality of life. If we improve the quality of life, automatically the quantity of life also will improve. So, impaired musculoskeletal health can lead to substantial personal, community, and societal consequences, especially in older people. Exactly what I said. Strong relationships between painful musculoskeletal conditions, lack of physical activity, and resulting functional decline and loss of well-being and independence, as well as depression symptoms, have been described in several epidemiological studies in the older age group. For example, a patient with arthritis or post-traumatic injuries or disabilities definitely going to be much lesser active due to their arthritis and pain symptoms. Because of this, the lack of regular physical activity will add to ultimate functional outcome of the person, which goes on the decline from there on. Most importantly, impaired musculoskeletal health causes reduced physical ability like grip strength, walking speed. Very, very simple activities like rising from a chair, climbing stairs, balance while standing, basic functions in the daily lifestyle, but those also get hampered because of impaired musculoskeletal health. If you ask me what is the impact of impaired musculoskeletal health, I would say that it is now recognized globally with an increase in the morbidity and mortality related to it. It would be a surprise for you to know that one of the most commonest causes of mortality in the older age group is trivial fall in the bathroom. You would find it funny, but basically trivial fall to the bathroom or sleeping is what exactly causes a hip fracture or a spine fracture. And from thereafter, if we don't bring the person back to their pre-injury mobility, the possibility of them to develop another fracture in the next 1 year also increases to 50%. So in this case, what we need to work at their confidence to be brought back to the pre-injury level. The start of which has to be treating them, getting them out of the bed by either surgical or non-surgical methods. I say the investment towards achieving that early on is maintaining a good musculoskeletal health. Musculoskeletal health has also become increasingly important for older workers as many occupations and work-related activities are associated with musculoskeletal disorders like back pain, shoulder disorder. That is the reason why it is important to identify and implement effective interventions for people with musculoskeletal conditions to remain productive at work. For example, people working in their respective professions, they have to be periodically trained ergonomic correction as well as correction in their posture so as to prevent these injuries from occurring. High income countries also observe musculoskeletal conditions to be one of the major causes of work loss, early retirement, and lost retirement wealth. Developing countries see musculoskeletal conditions to have a major impact on their livelihoods. Thus, a reduced musculoskeletal health results in reduced productivity and economic loss to the society at all levels. Since musculoskeletal conditions are chronic, painful, associated with disability and social disengagement, frequently causes mental health impairments such as depression and anxiety, as well as comorbidities. The burden of disease related to musculoskeletal conditions is not clearly denominated because the other comorbidities are the ones which are highlighted more. But the musculoskeletal health part of general health is ignored largely in implicating to be the cause of these injuries. Okay, so non-communicable diseases also account for most of the global burden of the disease, with musculoskeletal disease being the leading contributor. Non-communicable diseases like blood pressure, hypertension, diabetes also, if you see, even despite the pandemic, yet hypertension and diabetes still remain to be one of the highest mortality causes in the whole world. Not to mention increasing the morbidity and the mortality in the pandemic. Also, developed countries they recognize the transitional burden to long-term disability conditions. However, now low and middle income countries are also demonstrating the enormous future impact of musculoskeletal conditions such as osteoporosis, low back pain, driven by population growth and aging. So, the non-communicable diseases now account for most of the global burden of the disease, with musculoskeletal conditions also being the leading contributor to this. Developed countries now recognize the transitional burden to long-term disability conditions. However, now low and middle-income countries also are demonstrating the enormous impact of these conditions such as osteoporosis, low back pain, driven by increasing the population as well as aging. Since age is the commonest risk factor for musculoskeletal conditions, it is estimated by the year 2050 there will be a five-fold increase in the people over 40 living in developing countries, contrasting to the wealthier countries. Additionally, obesity, another important risk factor for many musculoskeletal conditions, is also hypothesized to rise dramatically in the developing countries for the next 2 decades. Further, increased use of uh, vehicles is not only reducing the physical activity but also increasing the numbers of accidents and reducing the muscular and resulting in again musculoskeletal trauma and disorder. The role of physical inactivity and a sedentary lifestyle in a daily life is the most important debilitating factor in musculoskeletal conditions. Sustained and systemic urbanization in developing countries is leading to sedentary behavior among the people, particularly the younger generations, where you can pretty much do everything at the top of my hand by just clicking a few buttons on the mobile. You can pretty much survive living, not getting out of the house. Because of which the physical activity is taking a hit. Because of social media, the movie streaming platforms, and binge watching, these are very important contributors to reduced physical activity. This surge in the sedentary behavior is not only a major risk factor for many chronic diseases, but is also recognized as a substantial global economic burden. Increased physical activity and optimizing exercise is recommended by the Arthritis Research Association of UK and WHO also in an optimal way to improve musculoskeletal health. A recent meta-analysis utilizing the data of more than 1 billion individuals concluded that a 1 hour of moderate level activity can eliminate the risk of death associated with 8 hours of sitting. Can you imagine this, how stark it is? For every 8 hours of sitting, if you can contribute 1 hour of moderate level activity, we reduce or nullify the risk of death because of the 8 hours of uh, inactivity. Thus, a moderate level of physical activity remains a key requirement for a healthy aging and maintaining musculoskeletal health. Sedentary behavior again also adds to the incidence of obesity and type 2 diabetes. Likewise, obesity is also a major contributor to the development of and progression of arthritis. The severe epidemiological studies confirming the link between a high lipid profile and joint degeneration. Evidence also suggests the increase in the levels of physical activity will not only increase the musculoskeletal health but also decrease the risk of suffering from obesity-related diseases such as diabetes. WHO recommendations on physical activity, as per the WHO, they recommend at least about 2 hours per week, 2 hours per week of moderate physical activity, or about 20 minutes per day of any kind of physical activity like brisk walking, being the bare basics. These exercises can just elevate the heart rate and are known to be associated with a lower lifetime risk of cardiovascular diseases. Apart from rendering musculoskeletal health benefits, improvements in the cardiorespiratory fitness can be achieved by changing sedentary behavior to achieve low intensity physical activity like walking. Exercise is now widely prescribed for the rehab of musculoskeletal injuries, and its use as a preventive health measure is now widely investigated, with guidelines around the type, frequency, and duration of activity being considered. In my daily practice, I don't don't recommend the person to uh, do a specific kind of exercise or to follow some kind of a physical activity. I just ask them initially for their complaints. I treat the complaints as well as prescribe the required exercises to alleviate the pain because of that medical condition. Uh, but beyond that, I implore them to pick up a physical activity which would be anything. It could be, but most importantly, it is something that the person he or she will enjoy doing. Only then will that person want to continue it by himself. Otherwise, I don't want it to be prescription. If I tell them to say you start cycling, you start jogging, start doing yoga, if you have facility for swimming, go swimming, it's a very good activity. Go running, go walking. But if that person is not inclined to do uh, that activity, if is not interested in doing it all that much, then he or she may not pursue it for more than a month or two. Now they have to have an interest into doing it. Now it could be the location of where that person is going to perform that activity or the company. So and that's why I ask them to pick up an activity which they will enjoy doing. Only then they will do it as an activity and not as an exercise to maintain a musculoskeletal health. The focus on evidence-based intervention for musculoskeletal conditions that cause the most disability adjusted life years. Low back pain and neck pain can be benefited by staying active and exercising regularly. Group exercise programs or weight loss support can be considered if required. To reduce the incidence of fall prevention is a very important topic which is largely ignored in our country, but it is a big thing abroad. It has to be underlined. It can't be exaggerated enough that fall prevention is very important in preventing all these diseases. The fall prevention programs are important as well as getting involved in activities like gardening or dancing, whatever they enjoy, as I said. Arthritis also has been shown to be benefited with activities and exercises that improve the muscle and aerobic fitness of the person, like walking, swimming, Pilates, weight loss support if required. There is a definite association between aging and the physical exercise. Aging is something which is inescapable, okay? But it can be made easier and healthy with the help of exercise. Exercise also gives benefits to an aging body, including reducing the manifestations of aging, especially the aging phenotype of the elderly. Uh, Very commonly we see elderly elderly patients who uh, maybe around 75, 80, but when you see them, you won't see them older anything more than older than 60, 65. That is because they have maintained an active lifestyle, they've maintained good eating habits, uh, because of which they have sustained so long. So that is the physiological age and neurological age is different. Physiologically, that person, at the same time, we see patients who might be around 50, but they look 60, 65. Again, this can be indicated to the lifestyle disease that that person is condemned. So, reviews also suggest that physical activity also makes a positive impact on the muscle mass and function of in the healthy subjects above 60 or more. Increased activity has also been shown to improve musculoskeletal health and prevent musculoskeletal health associated conditions in the osteoporotic and the postmenopausal females. Physical exercise programs also improves strength and balance in aging osteoporosis. Additionally, fragility factors like osteoporotic fracture risk is reduced by increasing activity, as exercise increases the bone density and reduces the inflammatory markers. Thus, having an active lifestyle from an early age and following recommendations for exercise could be beneficial for women. Furthermore, exercise and mechanical loading also have a positive impact on at the molecular level. Like with aging, the potential for cell proliferation and the number of stem progenitor cells decreases in tendons, exercise, or loading can induce an increase in tendon collagen synthesis, thus increasing the strength of the tendon. This exercise also has a positive role in maintaining the cartilage and the bone. Moderate exercise could also enhance the quality of tissue produced during the healing of injured tendons. Sedentary behavior, unhealthy diets, and the resultant obesity is also an epidemic with a sharp rise that we are seeing all over the world. Thus, there are great risk factors for cardiorespiratory as well as neurodegenerative diseases, which further complicates and the management of musculoskeletal diseases. Okay, so obesity is an important comorbidity of many musculoskeletal diseases and is closely related to development of osteoarthritis. It's basically a vicious circle. If you're not active, your lifestyle is very sedentary. You start putting on weight. You start putting on weight. The same weight is borne by the weight of the hips and the knees, which are not used for physical activity. But increased weight again adds weight to the already physically debilitated joints, which further progresses the arthritis. So this vicious circle has to be reversed. These strategies are aimed at reducing obesity in adults uh, are more important, and these can alleviate some of the pain of the condition. Okay, so interestingly, that is the only modifiable risk factor for arthritis. Exercise, weight loss have benefited overweight and obese adults in osteoarthritis in many clinical trials. Although in the older age group, we can't expect them to make that happen at a drastic level. So it has to be in a slow, sustained, medically fit method and not risking any preventable problems. The consequences of childhood obesity and physical activity is one of the most pertinent issues that we are facing today. The lack of physical activity in childhood also causes childhood obesity, which further leads to musculoskeletal pain in later life. This reducing the obesity in children by encouraging physical activity will also reduce the risk of developing musculoskeletal pain later in life. Consumption of unhealthy diet, fast food, and sedentary lifestyle all contribute to the increase of childhood obesity. So, a higher nutritional value food is more important recommended children. Low nutritional value junk food adds to the incidence of type 2 diabetes as well as cardiovascular disease. Yes, diet is an important part of healthy living, and this is inevitably an important part of healthy living. Okay, studies have shown that diets high in potassium, uh, which mainly we receive from fruits and vegetables, reduce the amount of muscle loss in adults more than 65. Dietary flavonoid intake, most commonly from fruits and vegetables, is also known to positively correlate with bone health in perimenopausal. Improving the diet of arthritis has also been shown to have great benefits like vitamin D, vitamin B12, as well as calcium, uh, and particularly protein consumption has been shown to optimize bone density, muscle nutrition in older patients, thus reducing the incidence of fall and fractures. Calcium in protein has to be synergistically optimizes the bone strength. Thus, dietary strategies for improving musculoskeletal health should include consumption of long-chain fatty acids, vitamin D, and potassium, which helps in bone and cartilage mineralization, and decreasing in the blood cholesterol. To summarize, what I always advocate is to my patients is to inculcate some kind of a physical activity which they will enjoy doing, and give them the bare basic example like the bone stock in a boxer in his hands would be much more because the utility of his hands is more. So what the body does is maintains a good bone density of his upper body and his arms. Similarly, in footballers, if you see the bone density is more in their legs because that is their profession, and that way the body modifies and maintains the bone density. Hence, the whole funda of maintaining the musculoskeletal health is by remaining active. In any injury or any medical condition, our main motive, especially in orthopedics, is to get the patient out of the bed as early as possible. Because the longer the patient is debilitated on the bed, the more the chances of secondary complications like chest congestions or infections, urinary infections, constipation, bed sores, all these start bothering. So before all these complications start setting in, which could be also complicated by the pre-existing comorbid factors like diabetes, hypertension, obesity. Uh, Before that sets in, we have to get the patient ambulatory as early as possible. So the best way to achieve that is by making sure that the prehab to any to every patient is very good. So prehab is something is again what we have been discussing on and off is inculcating or increasing the awareness of good musculoskeletal health in the population, be it the older or the younger age group. If we bring a healthy lifestyle, concept of healthy lifestyle in all the patient, all the entire population, it should go a long way in reducing the incidence of these nagging musculoskeletal health issues as well as fractures. So that has to be brought about in some way. That awareness is very, very important to be brought about. Thank you. Thank you. Thank you for the opportunity.